Hi all, we are in this moment with Dominique Bremond-Gignac, Head of Ophthalmology Department at Necker Hospital in Paris. Thank you, Dominique, to be with us.
Thank you, Matteo. It's really nice to be here, and I'm really very happy to have this sixth Aniridia Conference in Alicante. And last time it was in Paris, and Aniridia Europe is a very dynamic structure for patients and association, and so we're happy to be here and to exchange with all the scientific parties to make more studies and more understanding of the Aniridia patients.
As the chair of the scientific committee of Aniridia Europe, what is the highlights that you find today in all the sessions you heard or where you were in?
So there is many things, but many direction, and so we can see there is many possibilities, and we have seen new molecules that are just in studies. We have seen that inflammation is very interesting in the mechanism. We have seen neuroendocrine also, and we have seen all the clinic that could be more explained and more cured, even if we have not a specific treatment. And so that's very important, I think. And so today I just explain my study, which is on foveal ipoplasia. And foveal ipoplasia is part, of course, of the Aniridia disease. But we demonstrated that foveal ipoplasia is correlated with best visual acuity. So if you have a low-grade foveal ipoplasia, you have a higher best visual acuity. And when you have a high grade of foveal ipoplasia, your visual acuity is more affected. And the second point, which is really very important, we demonstrated that foveal ipoplasia is more common than aniridia in PAX6 mutation. It means that sometimes you have difficulties to make the diagnosis of aniridia because there is an iris, a quite normal iris, and so there is no diagnosis made because they think that there is no disease. And if you look, there is foveal hypoplasia, you can make a better diagnosis and more accurate in children. And so that's important to prevent some problems.
So when you find hypoplasia and foveal hypoplasia, obviously you have more elements to make a better therapy for children with aniridia. This is the sense?
The sense is when you find a foveal hypoplasia, you have more argument to know that it is a PAX6 mutation. Mm-hmm. And so if it's PAX6 mutation, you know that there is limbal insufficiency, there could be glaucoma, there could be cataract. And so if you know this is a PAX6 mutation, you can prevent, for instance, limbal stem cell deficiency by giving some eye drops, some lubricants without preservative-free. You can just check the pressure, ocular pressure, to detect early glaucoma, and you can just find out about a cataract. So this is an essential signs to be detected or like a checkup every time. So that's why it's important to make the relationship between a foveal hypoplasia and a PAX6 mutation.
And about this, after your study, what is the perspective and what is the opportunity or the chance to create some therapy or some clinical path to help patients in this sense?
So at the time, unfortunately, when you have foveal hypoplasia, this is something which is made in the structure of the eye. And at the other part, it does not evolve, so it stays the same. And so the perspective, which is not today, but the perspective is to have a possibility to restructure the retina. So maybe to announce a PAX6 production. And so we have seen in Atelleren studies in mice, only in mice of course, that it has been possibly restructure the retina. So maybe if we can go to a study very early in infancy or early in children, we could restore PAX6. And maybe if you restore PAX6, the retina could have an evolution in restoring the foveal ipoplasia to a less grade ipoplasia. But at the time, it's not something that is done. It's just a perspective. But we are looking for new molecules that could also restore PAX6 production. So let's see what's going on.
And also we learned today that the technology is helping a lot. I think to 3D bioprinting or AI in the genetics. So maybe there will be something also for this kind of problem in this sense.
Well, for restructuring retina is quite much more difficult than creating organoids for cornea. It's something different, but we never know how we can restructure the retina with a PAX6 restoration of production. So I think we have to wait for it and to see what will be.
Obviously, for a better future. Thank you for being with us and for your answers.
Thank you very much, Matteo, and thank you for all your work for digital diffusion for all patients and everybody. Thank you very much.
Thank you too.